and innovation on a recruitment and retention of nursing students from the demand side to increase production of nurse in Nam Pong Community Hospital, Khon Kaen, Thailand. We realize that current health services system in Thailand is not responsive to the population health need. Nowadays, the population health need is determined by the socio-economic as well as health dynamics. So transforming health workforce education to serve population health need is a part of the solution. Professor Dr. Pisek Lumpikanon, the former Dean of the Faculty of Medicine, Khon Kaen University, said that teaching should be changed. Instead of focus on content, it should be focused more on the way of learning. It has to be lifelong learning. Keep yourself updated with latest information in order to adapt to the change may occur. The most important thing is the user and the producer of the graduate should collaboratively work. What's the competency that the user needs from the graduate? The producer should know and produce the graduates with a competency to meet the population need. The major problem of health system in Thailand is the shortage of health workforce, especially for practical nurses. With the critical shortage in rural areas, the production and development community nurses is one approach for rural retention. The director of Nam Pong Hospital, Khon Kaen Province, has conducted this program since year 2002. Local high school students are selected based on their interest to receive scholarship from different local government or organizations to train in the community and return for their compulsory public work at Nam Pong Hospital. After graduated, community nurse has a responsibility of public work, both at the hospitals and in the community. Health is all dimensions, including quality of life, in line with the sufficiency economy. Currently, community nurses at Nam Pong Hospital are running their community health services over 75 villages with a ratio of 1 community nurse to 1 or 2 villages. Instead of curative care, health promotion, disease prevention, and rehabilitation are the most important role of the community nurse. They must work in collaboration with primary healthcare providers, sub-district local administrative organizations, and local people in community to strengthen the community healthcare delivery system in the community. Production of community nurse requires the cooperation from the community partnership, community hospital, and education institutions. There are 4 important steps of production as follows. 1. Student selection. 2. Students monitoring and evaluation. 3. Curriculum development based on close collaboration between education institutions and local communities. 4. Graduates monitoring and evaluation. The most important process to strengthen the community nurse is recruitment. The criteria is to select the student who has strong intention to study and really wants to be a community nurse. This one must be reviewed by all relevant local sectors. Dr. Vichai Asawapak, the director of Nam Pong Hospital, said that there are 4 principal processes of community nurse production, of which cannot be overlooked even one. The first one is the selection process. It must be reviewed by all relevant local sectors. At least includes the involvement of the community key stakeholders, community hospitals, and educational institutions. We select students that have good wills and are competent to study. It's different from the normal system selection, which will focus more on their knowledge background, and it will certainly reduce the opportunity of the students from rural area to be a candidate. Our students are closely evaluated and selected by the local people. To ensure that they really want to study at the nursing school, they are sent to do volunteer works in the rural hospitals and in the communities before final decision. We also probe their family background and the recognition from the community. Since 2002 until present,
Both private and public education institutions in Khon Kaen work collaboratively to educate the scholarship students to become a community nurses with humanized heart, pro-public work, and respect in their community. The College of Asian Scholars, a private educational institution, has offered this scholarship program since 2009. The school developed curricula in accordance with national standard under the following steps.
1. Firstly, the regular meeting has been organized at least once a month. The meeting involves instructional part, the scholars themselves, and resource part, which is hospital and community.
2. Secondly, curriculum development by integration of the sufficiency economy philosophy into the regular curriculum, as requested by the user. 3. The scholars required working at primary care unit, community hospital for training to gradually formulate close relationship to their own hometown during the semester break throughout the 4 years.
Professor Sawalak Yamtri, the Dean of the Faculty of Nursing, College of Asian Scholars, said that
we have provided an annual meeting conducted by community expert Professor Wichai and Professor Apisit. The scholars are welcome to join the forum.
We integrate the community-based learning into their regular curriculums. Some students get inspired and passionate and even become change agents through these activities. They also extended results and goodness of these ideals to others.
We have addressed the health problems caused by various factors, includes poverty, attitude, inequitable access to healthcare delivery system. Nampong Hospital, in collaboration with Ubonrat Hospital in Khon Kaen Province, which is a role model hospital, aims to promote self-reliant idea in the community.
The health professionals from the community hospitals are the leaders to change community to become a sustainable, self-reliant through well-being activities and the agricultural based on sufficiency economy philosophy.
Here's another community-based learning center. All community nurse students and families must learn about the sufficiency economy.
At the end, once they come back for work, they will be able to lead people to live based on sufficiency economy philosophy happily.
In addition, Nampong Hospital and Ubonrat Hospital also are healthcare provider learning center for different institutions in the province,
such as the Faculty of Medicine, Khon Kaen University, and Medical Education Center, Khon Kaen Hospital.
We aim to produce doctor to serve population health need in the Northeast, Thailand, having focused on community medicine. Then
the medical students will have the opportunity to learn the needs of the community from the healthcare provider. Then, Nampong Hospital has become important learning
and training center for clinical internship medical student. They have an experience to understand the community and collaboratively work with other professionals.
So they will be able to apply their knowledge to the professional work in the future.
Nowadays, Nampong Hospital and Ubonrat Hospital have extended their networking with the community to develop itself to become learning.
An interprofessional education training center for medical students in Khon Kaen Province and other areas.
With this nurse production process in Nampong Community Hospital for 15 years, only 7% of community nurse graduates resigned during the compulsory public work, compared to 30% normal resignation rate.
Dr. Wichai said, currently, Nampong Hospital does not have a shortage of health workforce, especially for nurses. We are able to lead the HRH planning in the hospital and community.
Nampong Hospital can give community health services to all villages in the area by community nurses and local people. Nowadays, our model is well received and expanded to all districts in Khon Kaen Province.
We also are a model of family care team of Ministry of Public Health, Thailand.